Why you absolutely do not need a rectal exam to screen for prostate cancer. I had a patient recently who, as I stuck my finger up his bum, he said, doc, you could have bought me dinner first, which I think just speaks to the fact that it's a pretty embarrassing, invasive examination to have done. And I know that a lot of men put off having prostate cancer screening because they don't like the idea of a rectal exam, which is entirely understandable. So in this video, I'm going to talk about why I don't think that you really need one. As you can see on this diagram, if you put a finger inside the rectum, you can feel the back surface of the prostate through the wall of the rectum. And the reason a rectal examination is recommended traditionally to check for prostate cancer is that if there's a prostate cancer on the back surface of the prostate, it can often be felt as a lump using a finger in the rectum. The problem is, of course, is that if there is a prostate cancer that's deep within the prostate or on the front surface of the prostate, there's no way you would feel it from a rectal exam. The other thing to remember is that depending on the size and shape of the patient, you might not be able to feel even the whole surface of the back of the prostate. So for example, if someone's a bit chubby, has big buttocks, or they can't bring their knees up to their chest, then sometimes you might only be able to feel a third or a half of the posterior surface of the prostate. And finally, it's a difficult thing to teach and to learn because, of course, patients aren't that keen on having medical students and junior doctors putting their finger up their bums all the time to learn what a normal or an abnormal prostate feels like. One of the best types of study to look at when you want to know the answer to a question like that is something called a meta-analysis. Now, a meta-analysis is when a group of researchers do a literature search looking for all of the available studies looking at a particular question, and they amalgamate all of the data from those studies, having determined which studies are good quality and which aren't, and then they come up with an overall figure as to how sensitive a test is in this case. The sensitivity of rectal exam in these circumstances is only just a little over 50%, which means there's nearly a 1 in 2 chance that if you've got a prostate cancer, your doctor won't pick it up with a rectal exam. Now, to me, that's not a very good test. The other option that is easy and cheap to access is a PSA or prostate-specific antigen blood test. Now, you can get this on the NHS if you ask for it in the UK, and I'm sure in most countries it would be covered by insurance. Now, unfortunately, the PSA has some problems as well. So it's relatively sensitive, far more sensitive than a rectal exam, but it's not 100% sensitive. So NICE tells us, NICE being the National Institute for Health and Care Excellence in the UK, that a prostate cancer can be present in up to 15% of men who have a normal PSA blood test. So the test is only 85% sensitive, obviously much more sensitive than a rectal exam, but still not fantastic. There's another issue with PSA which we need to talk about as well, which is where we need to introduce another term called specificity. Now, specificity is the ability of a test to determine that pathology or an underlying problem is present. The problem with PSA is that whilst it might have relatively good sensitivity, it's got really poor specificity. So NICE again will tell us that 75% of men who have an elevated PSA blood test don't have prostate cancer. What this means in practice is that if you rely on the PSA, a lot of men who don't have prostate cancer will undergo a lot of anxiety and a lot of unnecessary further investigations. This brings us on to the final test that's available for prostate cancer screening, which is a relatively new invention known as multiparametric MRI scanning. Now, this is a pretty sensitive test and also very specific, so it seems like the gold standard at the moment. It's not currently available for asymptomatic screening on the NHS in the UK, but you can get it if you've got an elevated PSA test or an abnormal rectal examination. If you've got the resources, you can access it privately, and I think if I had the money, it's something that I would definitely choose if I was going to have prostate screening. It's not a cheap test, but it is available, and if you check out the video description, you'll see some links to private providers who can help you if you want to access this test. The final thing that I want to talk about, and this is really important, is that I want you to all think really carefully before you go ahead with prostate screening. The reason for this is that we don't actually know whether it's a good idea to have asymptomatic prostate cancer screening at all. And that's because a lot of prostate cancers never actually cause the patient any significant harm. If you live long enough, then you'll almost certainly develop a prostate cancer. They say that 80% of 80-year-old men have cancerous cells in their prostate. However, that cancer will never do them any harm. It certainly won't kill them, cause them any pain or disability. they're much more likely to be hit by a car or die of a heart attack, a stroke, or some other form of cancer. And we have to remember that all of the treatments for prostate cancer are pretty unpleasant, with substantial side effects such as erectile dysfunction, problems with the waterworks, and problems with your bowels. So as things stand at the moment, we have very little information about whether prostate cancer screening is a good thing when it comes to saving lives and improving quality of life. So I'd urge you to have a very careful think about whether screening is something that you really want to do. If you're going to have screening, if you can afford it, have an MRI scan. And if you want to have screening but don't like the idea of a rectal exam, don't let that put you off, because it's not a very good test. I hope that helps. I hope it's given you a bit of information about the pros and cons of prostate cancer screening. And if there's anything else you want me to cover with regards to prostate cancer, then just drop me a comment below and I'd be happy to help.